Thank you for having this interview, Dr. Craig Tuttle. Now, people want to know, why did you become a chiropractor in the first place? What got you into it? What sparked your interest?
Well, when I was a teenage boy growing up in the Midwest, I had a bad acne condition, and when I was 15 years old, I had been going to a dermatologist, taking erythromycin and tetracycline, and seeing this dermatologist to get rid of my acne. I just wanted to, the truth be known, I just wanted to get a date with my girlfriend at the time. But I got tired of having my third eye, so I decided I was frustrated going and getting treatment after treatment, not getting results, and finally a friend of our family said, "Why don't you go see a chiropractor?" And I thought, a chiropractor for my skin? I didn't see the connection at all, and I was brought up in a more traditional family where we went to the doctor when we were sick, and I thought chiropractors were back doctors. And so this gentleman explained to me, he said, no, chiropractors are natural healing doctors that work on getting the pressure off nerves, and of course nerves control every function of the body, which I didn't know at the time. So I went to this chiropractor that he recommended in our hometown in central Illinois, and he checked me, and sure enough I had pressure on nerves going that controlled the sebaceous glands in my skin.
Oh,
and
really?
He started working and getting the pressure off those nerves, and sure enough, within a few visits and within 6 weeks my face was completely clear, which obviously made me very happy at the time. And so I was amazed at the ability of the body to heal itself, or getting pressure off the nerves that allow the body to function properly without drugs and surgery, and that really appealed to me at the time. So that was my first experience with chiropractic, and led me to my ultimate decision to become a chiropractor.
Wow. And so was that the only thing? Because a lot of people say, well, they try it once and it cleared the skin up, and then they think, well, maybe it was just a combination of things. So was there anything else in your life that happened to you prior to becoming a chiropractor that confirmed that this is what you want to do?
Actually, two things, Jeff, that made a difference for me. One, I saw a big difference. I was brought up in a very athletic family, and so I was able to run and perform the sports that I was involved with, primarily basketball at the time. It made a huge difference in my ability as an athlete, and it allowed me to run faster and jump higher and do the things that I wanted to do that I would have never had the opportunity to have happen had it not been for chiropractic. So it helped my ability as an athlete, and I was very excited about that. And then the second thing, I became very active in skiing. And I was skiing, and I ruptured a disc in my neck when I was skiing up at Whistler. And I had an experience where when the disc ruptured, they went to the ER and they took an x-ray, and they said your neck was broke, and come to find out that they recommended I see a surgeon to have my neck evaluated. And I went to 3 different orthopedic surgeons. All 3 had recommended I see and have surgery by the end of the week. All 3 confirmed the same diagnosis and the same recommendations for treatment. So I ended up not having had that surgery and just getting conservative chiropractic treatment, and it allowed me to return all my function back after losing feeling in my hands and having severe inability to move my neck and function properly. So I was really glad I knew what I knew.
Wow. How did you know to get adjusted as opposed to getting the knife and surgery?
Well, I talked to other chiropractors, and I talked to people that were involved with chiropractic, and talked to people that have had that injury. And the people I saw that had that surgery ended up, usually worse off and having more chronic problems in the future. And I didn't want to experience that, obviously. So yeah. The decision was, I think, pretty easy once I found out that there was a better result that could occur if I got conservative treatment. And I was so glad that I did, long-term wise, because it allowed me to do all the things I like to do now. I can still squat a lot of weight and do this. I ski all the time. I have for years and
regular
years.
Skier.
And I do all the things that I've always done. But at the time when I was injured, I thought I was probably done as a healthcare provider, and also as an athlete. And I thought that was pretty much going to be my career right there. But I was so glad I knew what I knew.
Tell me, now we know the reason why you got into chiropractic, healthcare. What kind of schooling is required in order to be a chiropractor? First of all, what kind of schooling did you have prior to being a chiropractor? And then what school did you go to in order to become it, and what was involved? How much schooling is involved? A lot of people don't know the differences between a chiropractor doctor and a medical doctor. Could you explain the schooling aspect?
Yeah, I went to undergraduate college, and I went on a basketball scholarship back in the Midwest to Augustana College. Also attended Bradley University, and I got my pre-chiropractic education in those two schools. And just like there's a pre-med program for a medical doctor going to medical school, I did what's called a pre-chiropractic education, which basically is the same education. You got to take your basic subjects of anatomy and physiology and chemistry, the subjects required to get your doctorate degree. And so I went to undergraduate college at those schools, and then also was there on a basketball scholarship as an athlete, which I grew up with a very athletic background. I was very strong into athletics, and I wanted to have an opportunity to play basketball. And I knew it wasn't going to be the next John Stockton, so I definitely wanted to get into healthcare too, and I was very interested in how that was chiropractic was helping me as an athlete, and how it improved my athletic skills in that sport. So that led me to my making a decision about which graduate school to attend.
Okay, and what was the graduate school did you attend?
I attended Palmer University, which is a chiropractic graduate school in the Midwest. It's in Davenport, Iowa. And Palmer is well known as the Harvard of chiropractic graduate schools. It's very prestigious, and I think doctors from all over the country advertise that, hey, I went to Palmer. And the education is the top in our profession, and I was very glad to go there. My oldest brother, who's a chiropractor, went there. I've got two nephews and a niece that went to Palmer as well, and are either graduated or about to graduate as doctors of chiropractic.
Nice. And how much schooling does Palmer required for the graduate degree? I mean, how many years? What kind of classes did you have to study in order to be a chiropractor?
Well, it takes 4 years of undergraduate college to get into Palmer, and then also after you go through that portion of your education, then there's 4 more years of graduate training. And the subjects that we took included subjects such as anatomy and physiology, chemistry, microbiology, obstetrics, psychiatry, orthopedics, x-ray, diagnosis, a lot of musculoskeletal training. So there was a very strong education. It's slightly longer than traditional medical school. So, and we also work with cadavers where we dissect bodies and study bodies to understand how the physiology of the body works. So our education is very intense, but I'm so glad that I went there because of that opportunity to get that formal level of an education, which is such a practical way to help doctors become the best they can be. And so it's a very prestigious school. I was so glad that I had an opportunity to go to school there.
Yes. And how did you do at Palmer, class-wise?
Class-wise, I did very well. I graduated in the top 20% in my class, and I had the largest practice while I was going through graduate school in the internship program, which is required in the education. So I was very active, involved with the clinic portion of my education, and I got to actually teach other students at the tail end of my education because of the background I had. So I was very excited about the opportunity of going there and then learning the information that allowed me to become the best practicing doctor I could be.
Was there any specialties that you learned at Palmer, and did that provide you with any opportunities?
Yes, when I was going through Palmer, I put a lot of emphasis on my education on the practical aspect of applying my art and skills as a chiropractor to helping people live healthier lives. And I became very interested in motion palpation, which is a specific diagnostic test that allows us to actually go in and feel for where nerve interference or where pressure was on the nervous system of a person. So by getting rid of that interference, it allowed the person to live a healthier lifestyle and improve the quality of their health. And so there was an examination procedure called motion palpation, which is a very common diagnostic tool that a chiropractor uses, but it was advanced training that allowed me to learn a lot more and improve the quality of my care for my patients. And so as I was going through graduate school, I spent a lot of my extra time in seminars and learning more and more how to be the best I could be at my profession. And when I graduated, I was asked to actually leave graduate school and go train other doctors around the United States. And so that gave me this skill level. And when I came to Washington, I actually gave seminars for other doctors to improve their skill level as well.
So not all doctors learn motion palpation the way you learned it?
Yeah, there's a basic education in it, then there's the advanced training, and I took the advanced training so I could be the best I could be at that. So, and then I was asked to go and leave and help train other doctors in that advanced training. So I have an extensive background in working with evaluation and treatment aspects of chiropractic, which allowed me, I think, get better results with our patients.
So after chiropractic school, they asked you to teach classes before you went off and did your own practice somewhere.
That's correct.
And then how long did you do that before you developed your own practice? You left.
After I came out of school, I did that on a part-time basis, and I was very excited to go apply my art and skill in chiropractic. So I came to the state of Washington in 1984, and I've been in practice for 26 years here now in the state of Washington since 1984.
Wow, have you always been in Seattle?
Yes, I have. I've always been in the Seattle area.
So 24 years since 1984, downtown Seattle?
That's correct.
Yeah. How's the practice going now? You've been here for 24 years, I can imagine.
Yeah.
Quite a clientele now.
Yeah, we have one of the largest practices in the United States, and we're very excited that we've had the opportunity to work with just about every background. I work with newborn babies, which is one of my favorite part of my practice, and I work with pregnant women and a lot of pregnancies, and work with on-the-job injuries and people in car accidents. I like helping people rehabilitate after injuries. A lot with the athletes. I've been asked to be the Seattle Seahawks team chiropractor. I've been asked to work with a lot of the athletes for the University of Washington and the local colleges and high schools. So I really have a more of a family style practice, and I work a lot with families with all kinds of various backgrounds, and it's my favorite part. I still have a passion this day. I get up in the morning as I'm showering. I'm excited and can't wait to get to the office to help people live better quality of lives, just like I've had the experience for myself and my family.
Yeah, I had a client I referred to you who just couldn't get out of bed because of back pain, and the next time I saw him, he was doing deadlifts with 45-pound plates on each side. It was amazing what chiropractic, because the regular doctors weren't able to help.
Well, that's what I love about chiropractic, is the results are so quick and so effective, and it's painless because it allows the patient to get their body working from the inside out, and then we teach them to live a healthy lifestyle, a wellness basis, so that the person improves the quality and the quantity of their life, and allows them to empowers them to go on to be better people in their lives, and maybe a better father, or better spouse, or better wife, or better at their sports or hobbies that they enjoy, and maybe even more productive in their work. So we like that aspect that improves the quality and the quantity of a person's life.
I can tell you really enjoy what you do.
I have an absolute passion for helping people reach their potential.
It really seems like you have such a passion on what you do every day, Dr. Tuttle.
Well, I do. I have an absolute passion, and even after 26 years, I still wake up in the morning and can't wait to get to my office, because I love seeing people reach their health potential naturally with chiropractic without drugs and surgery. And it's so neat to see people become better fathers, or better wives, or more productive in their sports or workouts, or even more productive in their work or with their hobbies. And so that's our purpose, is to see people reach their potential naturally without drugs and surgery, and so they can improve the quality and the quantity of their life. That gets me excited.
Fantastic. If you'd also like to reach your maximum potential naturally, and Dr. Craig Tuttle is definitely passionate about what he does, and he'd be passionate to help you out as well. Just call the number at the bottom of the screen here and make an appointment right away. Thank you very much, Dr. Tuttle, for this interview. It was a pleasure.
My pleasure. Nice to see you.
Nice to see you too, Dr. Tuttle.